There are serious concerns over government's vaccine programme and the rate at which jabs are being administered. There are even calls for the private sector to get involved in obtaining more vaccines. Business for South Africa chairperson Stavros Nicolaou speaks to us now. Thank you very much for your time this morning. So you're suggesting that the elderly and people from poor and vulnerable communities should be included in phase 1 of the vaccine rollout. But at this stage, we don't even have enough vaccines to inoculate healthcare workers at the rate that we had intended because of a shortage of vaccines. So how do you suggest we overcome that hurdle to be able to include more people in the phase 1 rollout?
Annie, thanks firstly for having me on your program. Business for South Africa is suggesting some tweaking of the 3-phase rollout that government has proposed. So phase 1 is very clearly the phase that deals with healthcare workers. We're not suggesting any changes to that. We do recognise that there has been some delay, largely occasioned by the AstraZeneca situation, which I won't go into. I think you've heard commentary on that this morning. So phase 1, healthcare workers likely to be completed by the end of April by our estimate. And then phase 2 becomes the focus. And what do we do with phase 2, given that there's not only a domestic crunch with stock, but there's a global constraint in most countries around the world. We face that crunch in Q2. The stock situation improves the way we are led to understand in Q3. So we need to manage scarce resources, scarce number of vaccines in Q2. We're proposing that the most effective way of managing, optimally managing, the scarce supply of stock that we have in Q2 by vaccinating your elderly first. Why is that the case? It's the case because the elderly are also the segment of the population that has the highest mortality rate. It's been demonstrated both in the first and the second wave. And secondly, we need to, what we call, bend or dent the mortality curve and not overwhelm the healthcare services and facilities. If we overwhelm the facilities and your elderly are the most likely to be hospitalized, then you are likely to have more aggressive lockdowns in the third wave. So it makes perfect sense for us, given the correlation between the elderly and comorbidity states, that the elderly are sequenced first in the second wave. We're not suggesting a major overhaul of the program, but just a tweaking to accommodate constrained stock supplies in phase 2, which is also in Q2.
Government has claimed that during the second wave, which we've just seen the back end of, thankfully, that the health system coped just fine and that they weren't overwhelmed. Do you think that was in fact the case, or are they overestimating the impact?
Because it's very hard to say what happened exactly with all of these things, because we're not seeing clear-cut trends here. So we were expecting a second wave. No doubt there will be a third wave. We don't know the timing or the magnitude of these things. So no one expected the sudden upward trajectory in the second wave and then a sudden downward trajectory. We thought it would have a more prolonged effect. So I think because it came down quite suddenly, it was a precipitous fall, in fact, I think our healthcare services did cope reasonably well. But I think a focus has to move on to the third wave. And how do we go about making the third wave a muted third wave, if I can call it that? And one of the ways to do that is we've got to be vigilant around travel restrictions, I think, interprovincially when we move into the Easter travel period. That's certainly one way of doing it. And I think we've got to continue with all the now well-established health protocols, social distancing, hand sanitizing, masking up, etc., etc. We have to, at all costs, particularly in the face of diminished stock supplies in Q2, we have to try and make the third wave a muted third wave.
We heard from Professor of Vaccinology at Wits, Shabir Mahdi, this morning that he doesn't think there's time to in any way affect the outcome or the severity of the third wave through vaccine administration. He says the only way to do so is, as you are saying, possibly further restrictions, masking, adhering to all the protocols, but that it's too late now for the vaccine rollout program to make any impact on the third wave. Would you disagree?
So, Annie, look, I don't think that anyone was expecting that a vaccine program, even in countries that are more advanced in their rollout than we are, that you prevent a third wave or that you even make a significant dent with respect to the third wave by only vaccinating. Right? So I think we've got to be realistic around what isn't and isn't achievable here. For me, the protocols that I've just discussed now, we're still going to be the most effective way of preventing a third wave. Not that you're going to prevent it, but you want to bend the curve there as well. You want to flatten the curve as best as you can. Would we have, with even a more aggressive vaccine program, prevented a third wave? The answer is no. And that's why these things require a combination of both measures and efforts in order to succeed. We've seen that in Europe and in other parts of the world, and the same situation arises here. So I think the best message to put out there is that we need to be vigilant around particularly super spreader events. I mean, we saw what happened with Rage at the beginning of December. In fact, I was looking at some graphs. In that category of sort of 18 to 20-year-olds, the curve went up like this. It was like a 90-degree curve. It went up literally. We've got to prevent that from happening in April, and that is our most effective measure of having a muted third wave.
Before I let you go, there's a growing push for private sector procurement to be allowed. Do you think that would help the vaccine rollout program?
Again, only I'm going to be realistic around what is and what isn't possible, right? So I think, first of all, the vaccine manufacturers have made it clear they don't want to sell to the private sector at this point in time. They feel that the even distribution of vaccines across all target population groups is best served through one channel of procurement, which is through government. So I think, if that is the position of the vaccine manufacturers, it's kind of a non-starter, isn't it? I think where we should rather focus is where can the private sector assist government in any form or shape with the procurement, but more importantly, how do we assemble and marshal all the extensive resources that reside in the private sector, both healthcare private sector and non-healthcare? How do we assemble all of those resources to ramp up administration of the vaccine to the general population as quickly as possible? We need to ramp up to around 250,000 vaccines a day on a sustainable basis in order to meet our 14 million vaccinated population target in 12 to 18 months. And I suspect that's where we should place our emphasis and focus.
Well, thank you very much for speaking to us. That was Business for South Africa Chairman Dr. Stavros Nicolaou. And of course, being able to get to those 250,000 doses a day, we need those jabs in the country, and it'll take at least a month to get to a point where procurement is ramped up.